Today's rhinoplasty video blog is about the lateral wall of the nasal tip. That refers to the area just above the nostril. This is an area that is important both for the appearance and function of the nose. Rhinoplasty is obviously an operation where we want to preserve function while improving appearance. And nowhere in the nose is this more relevant than on the lateral wall of the tip. This illustration highlights the importance of a soft triangular shape of the nasal tip. You can see at this base view that the tip is relatively narrow, the base is relatively wide, and in order to establish this triangularity, the sidewall has to be straight and supported. This area, the sidewall, refers to the lateral wall of the nasal tip. The lateral crural strut graft is a very useful structural rhinoplasty technique that allows the cartilage that forms the lateral wall of the tip to take on a straight orientation. In this patient example, you can see this individual has collapse of the lateral walls on both sides, creating both breathing problems and appearance problems. The lateral crural strut graft was placed to create a more triangular tip, so that the contour along this goes from a curved contour to a straighter contour, allowing the nose to take on a more pleasing triangular shape, a more refined appearance, and a better functioning nose. This additional case presentation is another example. In this individual, there was some collapse more on this side of the nose on the right than on this side of the nose on the left. This was leading to significant airway obstruction in the right nostril. And that collapse that corresponds to the pinching on the lateral wall of the tip on this side leads to this harsh shadow that you can see isolating her tip and making the tip look prominent. This is the before and after surgical photograph on the frontal view. You can see the shadow is gone, the tip is more even, it's more of a soft triangular shape, which you can really see from this base view. Because the lateral wall has been supported, the tip is able to be strengthened and repositioned. The triangular shape results, which creates significant improvement. During the surgery, I also performed maneuvers to shorten the limbs of the cartilages that form the tip that allowed me to shorten the tip back toward the face and deproject the nose into a position which created a more balanced profile. The clinical case I reviewed is a great example of where form meets function in rhinoplasty. Ideally, all rhinoplasty should lead to an outcome that looks better but also functions at least as good as it did prior to surgery. In the lateral wall of the tip, the sidewall between the tip and the base of the nose, that area represents a significant portion of the nose in which form and function work together. A straight triangular shape with a good transition between the tip and base is necessary in order to have a good appearance as well as a functioning nose.